President, when the Trump administration comes to an end, it is going to leave behind a host of sad and I would consider shameful legacies. And right up near the top of the list will be the shocking number of children who have lost health care coverage under this administration. Now, Mr. President, I'm sure folks can't really see the specific numbers here, but this trend line is what is important. Taking figures from the Census Department, people who are not political, they're not Democrats or Republicans, what this chart, based on census data, shows is that for year after year after year, we saw the number of uninsured kids in America go down. And that was something that I think was important for our country. It said a lot about our values, and it certainly said a lot about our health care system. This year, we're going to spend more than $3.5 trillion on health care. If you were to divide that up into 320 million Americans, you could send every family of four a check for $40,000. So we're spending enough on health care, but we're not spending it in the right places. And in particular, Mr. President, I wanted to come to the floor, and I'm glad to see my friend, the President of the distinguished body, who has worked with me on a variety of health care issues. We've got some areas that we're going to be talking about in the days ahead. To me, one of the areas in health care, until recently, we could all take pride in was this chart, which nobody could really see, but it would show this trend line that the number of uninsured kids was going down. And unfortunately, in the Trump administration, that trend line of years and years and years of more kids getting health care coverage has been reversed. And now more kids are uninsured. Now, how did the Trump people do it? They're not going to stand up in the front of a government agency and say, oh, we just don't like kids. But what they did is they hurt those kids and they hurt those parents and their parents by keeping them in the dark for years, while there were efforts, bipartisan ones. My friend who's joined the Finance Committee recently knows that our previous chairman, Chairman Hatch, worked with me for a record-setting extension of the Children's Health Insurance Program. The efforts to expand coverage for kids was always bipartisan, always, going back for really decades now, particularly on the Finance Committee. I think of the late Senator John Chafee, the late Senator John Hines, people I admired so much, and they always wanted to find common ground, Democrats and Republicans working for children. But now, the Trump administration in the dark has come up with proposals that have made it harder for parents to sign their kids up, harder for them to stay enrolled, harder for these families, parents with young kids, to even know about their rights to health care. And so now, as a result of the Trump administration reversing this trend of years and years of expanded coverage for kids, We've got hundreds of thousands of parents clinging to the hope their kids don't get hurt on the playground, catch flu in the classroom, or worse. And we know that this falls hardest on the families walking an economic tightrope. They're balancing every month their food against the fuel bill, and the fuel bill against the health care. And one injury, one illness could be financially devastating for these kids and their families. And it can be a major setback for kids for years, if not for the rest of their lives. How's a sick kid supposed to succeed in school and get ahead if they are unable to see a doctor when they have serious illnesses? Now, Mr. President, I've mentioned that I know the two sides, this side of the aisle and that side of the aisle, can work together to find common ground on children's health care. At the end of his service, Chairman Hatch, who, as my colleague, the distinguished President of the Senate, knows, cared greatly about kids, was very involved with the late Senator Ted Kennedy and others in coming up with the Children's Health Plan. He said, we want to set a record. We want to get a 10-year extension of the Children's Health Insurance Program. And we managed to do it. But if you cut the services for people to find out how to get enrolled and to stay enrolled, and if there are changes, in programs, those changes in policy, which took place when the Trump administration came to Washington, ripple through very quickly to communities across the country where vulnerable Americans depend on getting good quality health care. And I just think it's unconscionable. As I mentioned earlier in my remarks, that for a country with the resources America has, that you wouldn't step in if you saw this trend of progress, fewer uninsured kids, suddenly be reversed. And it really happened very quickly. When the Trump administration took over, you'd say, hey, let's get Democrats and Republicans together here and pull out all the stops to fix it and get the trend lines going in the right direction again with more kids getting health care coverage. We would have had to take on the Trump administration here in the Congress. We would have had to take on all those programs to make it harder, where the Trump administration made it harder for kids to get enrolled and to stay enrolled. But it would have been the right thing. It would have been the right thing for Democrats and Republicans here in the Congress to step in and take on the Trump administration and say, look, we understand there can be debates and differences of opinion, but you don't score points by attacking the services for children available under the Affordable Care Act. So, Madam President, I'm going to keep working to reverse this crisis. My colleagues have been coming from this side of the aisle all through the day to talk about this scourge, the reversal of the trend in this country with respect to health care coverage. We used to be expanding it for kids. Now it's going the other way. The amount of coverage is being reduced. And I just want to say, Madam President, as the ranking Democrat on the Senate Finance Committee, which has jurisdiction over many of the health care programs that are most important for kids and families on an economic tightrope, I want to say that I know my colleagues on the Finance Committee, several of whom have spoken over the last few days on this subject, we would be glad to work with any Republican here in the Senate who wants to turn this around. If any Republican is listening to this and wants to come to the floor and say, I'm interested in turning around this ominous trend. I'm interested in turning around this trend where health care coverage for kids is going down, and I want to work with Democrats to do it. I will commit, as the ranking Democrat on the Finance Committee, to say, thank goodness, we got to get on this. This is too important to our country and to our future to just sit idly by and say we're going to reduce the number of kids who are getting health care coverage because we're not going to give parents the opportunity to find out how to get enrolled and stay enrolled and know what their rights are. A country as strong and good and rich as ours ought to be looking for every possible opportunity to help kids get ahead in life. That, in my view, Madam President, starts with access to health care, and right up at the top of the list, it starts, in my view, by saying this trend line, which after years and years of showing more kids were getting covered, is now going the other way, and fewer kids are getting covered, that we are going to say as a body here in the United States Senate, we are going to change that. And in a country as strong and good and rich as ours, those vulnerable families are going to be able to get health care again.